Hi there, it's Dr. Kevin Logan from the Logan Institute for Health and Wellness in Fishers, Indiana. I'm very excited to meet with you today and talk about the things that are happening this weekend. So I came to the conference at Rejuv Med up in Minneapolis. This is where a lot of the thought leaders come together that are really discussing advanced techniques for regenerative medicine. One aspect of that is the red light therapy. Photobiomodulation is the formal name for light therapy. Light therapy has a long history and it has a lot of scientific data to support the application. At the Logan Institute, we've been doing photobiomodulation for the past 25 years, and now we're excited to partner with Vive because people can use this light therapy at home. They can get ongoing benefits for a prolonged period of time for lots of conditions. I want to introduce Dr. Desai, one of the founders of Vive, and I'm excited to meet with him and talk about new protocols and also discuss some of the new science and application of this technology.
Thank you for having me on and talking to me about this. So it's been a journey and really exciting. So red light therapy or photobiomodulation, our devices are using red light and near infrared. That's kind of the medicine, and that's been available, in different forms and lasers and lights, and oftentimes something that needed to be in the clinic. This device, like Dr. Logan said, gets to go home, and it's an extension of Dr. Logan's clinic to your home. And the applications, we really started this. I'm a musculoskeletal radiologist and regenerative medicine specialist, and started this for pain and healing of tissues. And that's one of the more powerful applications and something that we have a lot of experience with. These therapies can be used for pretty much any cell, and it invigorates the cell and helps healing, so skin, rejuvenation. People have seen a lot of the red light masks. This is the same energy. And then, fascinatingly, pretty much any of the tissues that we apply this to, it can help heal, reduce inflammation, improve collagen. There's another pathway. There's two ways that the light gets into the body, and it affects the photoreceptors in our body. One is in the tissues. Another way that the light affects us is through our eyes. There's an optic pathway, and that optic pathway stimulates cells in the retina. There's photoreceptors, and it affects our brain health. It can affect our circadian rhythm, so we can have much better sleep. Our sleep architecture improves. We get better deep sleep. That's when we heal. At night, if we do apply this medicine to our eyes, even in an ambient way. Before, when we're using this to help tissues heal, it has to be really close and applied to the tissue. With the effect on the retina, you can put it on in the room, and as long as you're seeing that red light, it's affecting you. It's kind of like the anti-blue light. We have blue light blockers and those types of things. This is working in the opposite way, and especially in the evenings, like dawn and dusk, it's replicating our dusk time, and it's stimulating our body to heal. So it increases, there's receptors in the retina, it stimulates that connects to our brain, and it releases increased melatonin, it increases our growth hormone production and release, and it suppresses cortisol, modulates cortisol. So we get a much better sleep, a much cleaner sleep, and that's when we heal. The other thing is, have you heard of the brain washing system?
Yes.
Yeah, and so there's a system in our brain when we sleep, and especially when we get deep sleep, that's when we're able to get rid of all those kind of toxins and chemicals that build up over the day, the proteins, like the beta amyloid proteins. We heard that for Alzheimer's. Sure. So it's a washing system. These channels open up in our meninges and our vessels and our blood-brain barrier, and our body absorbs that and gets rid of it. And there are times of the day when that's needed. And if you get poor sleep, then those build up. So they're much more prevalent in the evenings. And so this is something that, applied in that evening time, is going to help our sleep, it's going to help our brain, our neurocognitive issues. It's been shown to help anxiety and depression. And so there's a huge field that we're learning about. And I'm still, we're learning every day, that we're learning how this can be applied. And the really cool thing is that this application can be done on a daily basis. And now we have something that can extend your clinical effect. And I've helped so many thousands of patients. Now this is another avenue of doing that.
That's great. So that was one of the things I was super excited about when we were talking about sleep and the circadian rhythm. One way that we apply this, or one way that we can apply this, is we actually increase the catabolic effect in the morning, so we can apply the red light. So we're going to increase ATP production within the mitochondria and help normalize all the hormone pathways. And then the evening, we're going to help to enhance that anabolic effect, which happens at night while we're asleep. So we're regenerating, so that's going to help with sleep, regeneration, help us build and detoxify at the same time, plus help us feel rested in the morning when we wake up. So I've been doing this inadvertently because I didn't know about these effects, so thank you so much. But I've been doing it every morning, and it's way better than a cup of coffee. I start my day with the red light, activate all those systems, and I feel energized throughout the day. And of course, all the other applications for pain and inflammation are truly amazing. We've seen great results with our patients. So I appreciate you really helping to advance the science. So Dr. Desai is going to be working on a database. Our patients can participate in that, so we can continue to accumulate data and really show how effective this is in so many different applications.
Absolutely.
So.
Thank you so much for trusting our device and our company and the medicine, and thanks for having me on.
Absolutely, absolutely. Thank you.